Doctor, talking about myths around allergies, one of the common myth is moving to a new climate can cure your allergies. Is that true?
Well, moving to a new climate won't cure your allergies, but it will definitely reduce the allergy triggers, because what you might be allergic to in one particular geography, that particular allergen might not be in the new geography. Hence, you might not be having that amount of allergic intensity. But the cure of allergy is not going to happen, because allergy, as I would have told multiple times, it's in your blood, not anywhere else. So we can't remove your blood and we can't throw it out. So getting a cure for allergy is not possible. We can cause desensitization, which is possible, such that you getting triggered by any particular allergen is reduced.
Okay. Uh, and hypoallergic pets don't cause allergies.
That's again a myth, because if you're allergic to any particular, say if you're allergic to a particular dog or any a particular cat, or you are allergic to any kind of reptile, if you are allergic to the dander, the skin particles, or the skin which is shed by the
The
pet,
fur.
the fur or skin, so that even if you go to anyone else's house, and if they are not allergic to that particular pet, and they say that's hypoallergic, and you are allergic to it, and you go there, you will automatically have allergy. So that's kind of a myth which is being marketed by pet shops and other people to ensure that the sales gets boosted.
And do flowers cause hay fever?
No. So flowers have sticky pollen which can't easily fly off. It's usually the pollen from those grass and other grass related family plants which have very light pollen which can be taken away by air, and those are the ones which can go into your nose and trigger your hay fever or allergies and sneezing and bronchial asthma and other things. So bright flowers which are beautiful don't cause allergies, until unless you shove the whole flower into your nose and smell it. Yes, then it can cause, but as such, no.
Is it genetic allergies? Is it genetically transferred?
Yes, so allergies, as I mentioned, is in the blood. So since it's in the blood, the chances of some, if your parent or your sibling has allergy, the chances of you and your progeny developing allergies is higher because of the genetic makeup of the blood. So yes, it is genetic. But again, the trigger factors are something which is more localized. So, what someone might be allergic to, if your father is allergic to, say, shellfish, the chances of you being allergic to shellfish is also there. But again, it varies with the genetic markups.
Is it more nature versus nurture? Like if somebody is grown eating a particular type of food, is there a chance they can overcome that?
Yes, that's possible, provided they get desensitized. So that's why desensitization is very essential. So if you get exposed to small amount of this particular allergen over the childhood, you will not develop these allergies later on in your adult life, or you might not get triggered by that particular allergen. But if you're not exposed, and if your parents feel that, oh, you might get triggered, and they might be safeguarding you, then the chances of you developing the allergy is sky high, because you're not exposed to that to develop the other types of IgG antibodies which are regularly produced. Instead, you will produce IgA or IgE antibodies which can lead to your triggering factor.
And doctor, also talking about certain diets, do they help cure allergies? Is there a cure for it?
So as I mentioned, there's no cure per se of allergies, but you can definitely get desensitized from any particular triggers which you might have specifically identified by taking some small doses of those allergens in a regular format to desensitize it. But cure per se is very difficult, and it's not known.
Thank you so much, doctor, for bursting these myths on allergies.
Welcome.
Thank you so much.
Welcome.
Watch us for more such informative videos.